Now to an update on an HNN investigation into Hawaii's one-sided kidney trade. Over the past 8 years, hundreds of kidneys donated in the islands have been shipped to the mainland, while Hawaii has received only a few in return.
Well, now the committee in charge of making sure organs are distributed fairly admits it did not consider Hawaii's proximity to the rest of the country. Our Allison Blair reports.
Weeks after HNN Investigates started asking questions about the striking disparity, we received a statement that said the Organ Procurement Transplant Network Kidney Committee and Board of Directors did not consider the geography of Hawaii, Puerto Rico, and Alaska during its kidney policy allocation process. Now a Hawaii Congresswoman is demanding more information and perhaps a change to national policy.
100% geography needs to be taken into account. You cannot forget us just because we're not part of the continental United States, whether it's us, Alaska, the territories.
Congresswoman Jill Takuta is speaking out over concerns patients in remote communities may not have a fair shot at a kidney transplant. According to officials at the United Network for Organ Sharing, or UNOS, kidneys are first offered to waiting list candidates within a 250 nautical mile radius of the donor hospital. But there is an exception. If a donated kidney matches a patient that UNOS considers biologically difficult to match, that patient gets first dibs no matter where they live. It's a policy that rarely benefits Hawaii residents. Records obtained by HNN Investigates show between 2017 and 2024, a total of 604 kidneys have been donated locally. Of those, 232, nearly 40%, were sent to patients living on the continent. During that same 8-year time period, Hawaii received just 5 kidneys in return.
We are giving of ourselves, literally. Meanwhile, our people are dying on the list. And that's absolutely unacceptable.
It's why Takuta authored this letter February 24th, addressed to the Chief Executive Officer at UNOS, Dr. Maureen McBride.
This letter is really to make it very clear that we understand these extreme disparities exist. There is a problem. It is unacceptable. Give us more information. Talk about what you are going to do to bring about changes when it comes to access for rural and remote America, like Hawaii.
It also cites a law passed in 2023 meant to ensure the system operates fairly and serves the people. Takuta wrote, "I believe it is important for Congress and the public to have a clear understanding of how the system is functioning, the efforts being made to address existing disparities, and how accountability is maintained." She also wants to know more about the more than 200 patients currently on Hawaii's kidney transplant wait list.
We need more information.
According to UNOS, of the kidneys that were transplanted in other states, 55% had been offered to a candidate listed in Hawaii before they were accepted elsewhere.
How many people in Hawaii actually received that call, and why did they not take the kidney? What are these factors so that we can understand whether we've got to be doing something on our end to, again, improve the odds for them?
Only the Organ Procurement Transplant Network's board has the authority to change the agency's organ allocation policy. HNN Investigates will continue to follow this story and bring you any new developments. Allison Blair, Hawaii News Now.
Thank you, Allison.